views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
To another episode of Meetings of the Minds in partnership with BronxNet. As you already know, we had to create Meetings of the Minds in response to COVID-19 pandemic. I mean, its goal was literally to separate us, but we said, we don't think so. We have digital and we have virtual. So this is our way of continuing to share resources with one another and make sure our partners, our members, and our affiliates stay connected. If you are not yet a member, it's very, very easy. www.hispanicchamber.nyc, www.hispanicchamber.nyc. Today, I have the honor and privilege of introducing our newest member, Memorial Sloan Kettering Cancer Center. And with me today is Ms. Julia Ramirez, Community Outreach Manager. And she is also a 2020 Hero of Hope Award recipient for our virtual business banquet and scholarship award reception. Let's learn a little bit more about Julia. Let's see what she's done. Let's learn a little bit more about Memorial Sloan Kettering and how it benefits our community and the resource it has to serve. Hola, Julia, ¿cómo estás? And how is your family?
Oh, thank you so much for having me today. This is so wonderful. We are hanging in, everyone, family is safe, and that's what's important right now. But I'm coming into the office every day. So I'm not working from home anymore, which is nice. I actually like coming in and being around people.
You know, whether you have been in the office or not, you have never stopped working, hermana. Tell us a little bit more about what you do.
Sure. So for the last 16 years, I've done a lot of work in the community, working with our most vulnerable patients, really making sure that cancer patients had access to the services they needed while undergoing cancer treatment. And providing that safe space where patients could feel like they could ask for help and not feel bad about needing that extra help, especially right now.
You work specifically with the immigrant community, correct? Can you tell us a little bit more about that initiative?
Sure. So as I said, in the last 16 years, I've worked for a group called the Immigrant Health and Cancer Disparities Service, in which we work to bridge the gap between the underserved population and the healthcare system. And two of the main projects I oversee, or that I oversaw, is the Integrated Cancer Care Access Network and the Food to Overcome Outcomes Disparities Program, which is a food pantry program tailored to that addresses food insecurity, and it's co-located in the hospital setting.
Mm-hmm. No, let me tell some facts about what you did and what you were able to create. Okay, does the number 19,800 ring a bell and 400 families ring a bell? Because that's exactly what you did. During COVID, you were able to feed, again, 400 families, not just cancer patients, but their whole entire families. Tell me how you got that started, the partnership that you had to create to make this happen in the height of the pandemic.
Sure. So, in early March, when we started to get all the news about people having to shelter in place, the first thing that came to mind was our patients. How are our patients going to, how are they going to eat? We didn't want them worrying about where their next meal was going to come from, because for many months, patients were coming on site to pick up the food from the food pantry. So I had to immediately pivot and think about a creative way to make sure that our patients stayed safe, but that they had access to what they needed most, which is the food. And so, you know, I I took a leap and I thought to myself, well, right now people are being redeployed to other areas of the hospital. Who could we partner with that could really help us, get the food to the patients? And so I asked our hospital leadership, would it be possible if our transportation folks at MSK could help us deliver some of the food on a weekly basis? And I was so shocked that, like, I was shocked, but also that it happened so quickly. Like within hours, we got approval to do it. And that was, I mean, first of all, for my staff, because they are so committed to the cause and making sure that patients have access, but making sure that we also had the resources to get the food to all the different locations. So we partnered with our transportation team, but we also had to think a little outside the box. And we had a program, because we have 12 pantry programs, 12 sites. So how could we get to everyone and the 5 boroughs? So we also have a taxi driver initiative, and we hired some of our taxi drivers to help us deliver half of the food. So half of the food was delivered by our MSK transportation team, and the other half by yellow taxi drivers.
All I have to say is one thing. Esto fue implementado por una Latina emprendedora. This is what I'm talking about. When situations get tough, we get even tougher with them. And I have to applaud your bravery, your courage to bring this to higher leadership. And I'm proud of the leadership at MSK who immediately said, yes, let's do this and let's make this happen. It is such an amazing story of what can happen when we work together. 19,800 meals and counting. Taxi drivers giving back their jobs, transportation within MSK working together, and staff members around the clock. Brilliant, brilliant, my sister, brilliant. I want to say this: how do we, as the New York City Hispanic Chamber of Commerce, and everyone watching this, support you? What do you want us to know about MSK?
I want you to know that we welcome everyone. We have so many resources for our patients. I think especially given, the Immigrant Health and Cancer Disparity Service, that not only do we have programs at MSK, but we're also going out into the community. We go out into the community and are providing education around screening and prevention, and how to make sure that our community members can navigate the system. And if they need assistance, either coming to Memorial, that you can reach out to us. Right now, especially during COVID, so many people have delayed going to get their screenings and their follow-ups, and it's safe to come, so we want to be a resource for you. I think, and as you mentioned earlier, I actually have just transitioned into a new role, and now I'm the Director of Patient Relations for the hospital. And so really making sure that I'm advocating for our patients, and that, they have the resources that they need. They have the information that they need in order to make their cancer journey easier. And having that point of contact that they know that they can reach out to us, that we have individuals who speak Spanish who can help them, and can provide the appropriate resources to connect them to what they need when they need it the most, which is really, really important to me. I think, being Latina, growing up, I was that navigator for my own family, right? Helping them. And I think that's why this work is so special to me and touches me in a very different way, because I was that little girl having to help my grandmother, having to help my mom and my siblings. And now to be able to give it back and to be able to touch these patients' lives means so much to me.
Everything in life is a preview, right? Even your heart. So your heart has been there from the very beginning, and we're so grateful that you share it with us and our community. We congratulate you on your award, Julia, and you are who we need So we appreciate you being there for us. And please note that we will also be there for you. Now, how do we access these resources? What's the best way to do that?
So certainly you can, for immigrant health and cancer disparities, there is the 646-888-4600 number. And certainly you can always call there and one of the staff as part of the Immigrant Health and Cancer Disparities can certainly help and connect to the food program. And I think that's always the best way, but of course, going on our website is another way to access, just all the different programs. And you can search for the food program and it certainly will come up. But I think calling is the best way, because then I always think that connection is really important, and not having to fish around the website to try to find the right information. But I think that connection is always best, and having to speak to someone that can connect you directly to the service right away is the best way to go.
We love that. We love that. It is the best way. You get to hear someone on the other line and speak to a human being and really get the services and resources that you're looking for. We thank you once again. We're so proud that MSK has decided to become a member, and we're so excited to be honoring you for our 2020 Virtual Business Banquet and Scholarship Award recipient. Thank you so much. You are our hero of hope. We appreciate you.
Thank you so much. Thank you for having me. This is such an incredible honor, and I feel truly blessed, really, truly blessed.
You know what they say, or my mama says, well, God bless, no man can curse. and that's a wrap, guys. We'll see you soon.